Thanks. That was terrific, as was your report. I was a little confused about early on. You said that you did not include strictly attitude measures, and that seemed like it included satisfaction measures. And then you were surprised when you didn't have too many studies that had satisfaction measures. Did you just exclude loads of them because there was also not an objective measure?
We considered patient satisfaction to be one of the objective measures. Okay, what we didn't include was did the participants, the learners, feel that they were better prepared, or did the learners believe that they were better team participants? Those we excluded, but we did consider patient satisfaction to be an objective measure. Now, I do also want to say that there are likely to be studies that you all are all familiar with that escape this survey. I showed you the methods that we use, and I can certainly share with you the search, the mesh headings and all of those that we use, but I am convinced that there were studies that we missed given the time that we had in doing that. So I think the committee would obviously appreciate others' knowledge about those studies.
Brenda Zerler.
Brenda Zeeler, University of Washington. Thank you, Tina. That was an excellent review. And the question I have, and that I think that we're going to struggle with over the next 2.5 days, is looking at IPE as a separate entity in practice, because most team training doesn't occur. There's an impetus for the training, or there's a need. So there's a team diagnosis. So they're having problems with conflict or handing off information. Could be workflow. So it's not that the studies aren't just going in and implementing team training. There's a reason for doing that. So I think thinking about that now, I think it's going to be difficult to not look at practice, because if it's about relationships and communication, yet the workflow is so awful that it affects people's behavior, and then by not looking at that practice component or the changes, I think will be difficult. However, I agree with you that direct observation will be very important. But in the team diagnosis, there's going to be the baseline team, how the team is behaving, what's the workflow, what's the leadership, what's the infrastructure look like, so who's on the team.
Right.
And so that also, to me, is important, of how many people that were on the teams in these studies who didn't really participate in the training.
Right, and I agree. I think if I could just nuance just for a little bit too, it's not just that you have the team training and you have the practice training, but a lot of what we're doing is that the team training is about changing the practice, and again, really trying to feather out, and Chris resources a lot about that, we're trying to feather out how much of the actual sort of team training piece versus you just bring people together to address a problem. How do we measure that in terms of team training? And I think one of the most bold examples of that is there's now increasing studies where you team train individuals to change their practice. I don't know if that makes sense, but one of the studies was that there was an team educational intervention for physicians to support them to be better at diagnosing and treating depression. So the outcome was totally the physician practice and the patient outcome, but the training was team training. In other words, imbuing individuals with a broader perspective. I mean, I think there's so many layers and ways of thinking about how we really bring together the training with the practice.
Dr. Reeves.
Thanks, Tina. I agree with your conclusion about longitudinal studies, and I think we really do need to think about how interprofessional education has a long-term or not so long-term effect on practice. The kind of critical thing, and it's something that we're going to have to struggle with, is these studies cost a lot of money.
Yeah.
And it's one of the big problems because interprofessional education is an education, traditionally it's been an educationalist activity, often sort of around the margins with little pots of money. So as a result, the studies are sort of small in nature. So I was just wondering, in terms of when you were reading that sort of literature, did you get any clues to some of those bigger studies where they were funded? Because again, as I was saying, it's something that we really need to, because we can make all the recommendations about big studies, but if there's no one going to fund them, it's going to mean nothing.
I think that's an excellent question. The short answer is no. I'll tell you the two things I do know is that some of the largest studies, unsurprisingly, were at the VA. And then there was a study that was funded by an insurance company, which I found to be very interesting. And at the Macy meeting down in Atlanta that was alluded to, aligning interprofessional education with practice, one of the groups that I was involved in was looking at funding. And there were representatives from the healthcare insurance community there. And they were really starting to think about, if you can show us some of this kind of data or different kinds of data, we're going to start being interested in rewarding you for training your people better to have more efficient, effective practice. I haven't seen that happen yet, but there was one study where they did that. I think that would be very interesting to really look at that community and as the data begins to emerge.
Dr. Wu?
Along those, so you didn't find any malpractice insurers who are funding team training? It does seem like that's a group that is, no, that honestly is, I know of some examples where they're doing that.
I didn't see that as a reported piece of evidence in the studies that were included in the review. I would be very motivated to go back and look and see if that was somewhere that I didn't see it. But then one wonders what they were funding. If there are several of those, why didn't they fall into these criteria would be another interesting question.
Well, thank you very much, Tina.
Thank you. Thank you.
So Jill Thistlethwaite is now ready to give a sort of generic response to this report. Jill?